Okay, so to start out motioning the occiput, I'm going to have my fingers on the mastoid and I'm going to be testing for rotation on both sides. I'm going to place my middle finger on the C1 TP and then my index finger on the mastoid. I'm going to test for lateral flexion. Okay, and then if I find a restriction, so if there's a left lateral flexion or left rotation restriction, I'm going to be on the right side. I'm going to have my MCP on the mastoid fossa. I'm going to laterally flex my patient, rotate, slight extension, follow my contact around, and then my vector is going to be P to A. Okay, and so now I'm going to assess TMJ. So I'm going to just be placing my fingers on the joint and I'm going to have my patient open her mouth and close and open and close, feeling for any restrictions. And so then I'm going to have my patient lay down and I'm going to have her lay with her right side of her head up, and I'm going to support her head, and then I'm going to take my right pisiform and I'm going to contact the joint. I'm going to traction with my left hand, and then I'm going to traction, and then impulse, and my vector will be P to A.
Oh, yeah.
Okay, so to start, I'm going to motion out the thoracic spine. So I'm going to have my patient have her arms on her shoulders, and I'm going to motion for extension. I'm going to do rotation.
I did that. Left or right side up. So
Do rotation again.
right side down.
And then I'm going to have you give yourself a hug.
Yeah, right side down with your
I'm going to
knuckles.
come in here.
Unless you want to bring
towards
it
me.
up.
I'm going
So
to
you find,
do
so it's find
lateral
the
flexion, and then the
T6,
side.
TP, left TP,
First lateral flexion, and then I'm going to, if I find a restriction, I'm going to have my patient lay face down. I'm going to be on her left side. I'm going to find T6, and then I'm going to have my bear claw contact, and I'm going to start at the top of her spine. This is not good. I just have to. Okay, so bear claw, find T6, start pointing up with torque, and then you have my patient breathe
So if I
in
felt a
and breathe out, and my vector is going to be P to A with
6, I'm going to
clockwise
find
torque.
the
Okay, now I'm going to be testing movement of the glenohumeral joint. So I'm going to be testing for internal rotation and external rotation. And if I find an internal rotation restriction, I'm going to do a pin and stretch assessment. And so I'm going to brace her arm on my leg, and then I'm going to pin and stretch for the internal rotation restriction. Okay, so now I'm going to be assessing the radial head for motion. So I'm going to start. I'm going to be motioning the radial head, feeling for any restriction. And if I find one side that's more restricted than the other, I'm going to have my patient extend her arm behind her, and then I'm going to have my thumb contact on the radial head, and then I'm going to, my vector is going to be P to A. Okay, now I'm going to be assessing the wrist carpals of my patient. So I'm going to be feeling here, feeling for any restriction, and if I find that there's a restriction with flexion, I'm going to bring my patient's wrist into flexion, have her lean back, and then I'm just going to impulse. Okay, so now I'm going to be assessing my patient's TL junctions. I'm going to have her place her arms on her shoulder again. I'm going to be feeling for any flexion. I'm going to be feeling for rotation. Go on the other side. Feeling for any rotation. Okay. Okay, just put our and then I'm going to, once I find a restricted area, I'm going to place my flat hand on the segment, and then I'm going to have my patient tuck her head, and then she's just going to lean back, and then over my patient, and A to P. Drop. Okay, so now I'm going to be testing the motion of my patient's hip. So I'm going to be starting, and I'm going to be testing for external and internal rotation. And then move on to the other side. Alright, and then if I find an internal rotation restriction, I'm going to wax off in the tug of war position, and I'm going to long axis distract, and my vector will be a long axis distraction. Okay, now I'm going to be assessing the motion of my patient's fibular head. So I'm going to sit here, I'm going to sit on her foot, and I'm going to be pulling her fibular head from A to P, P to A, and then do it on the other side.
Over my contact.
Alright, and then if I find a restriction, I'm going to have the patient roll over, and on her right side, I'm going to be on my knee, have her foot on my shoulder. I'm going to take my pisiform contact on the patient's fibular head, reinforce, and I'm going to distract back, and my vector would be P to A. Okay, so now I'm going to test the motion of my patient's first MCP. I'm going to be using corkscrew motion. So I'm going to take her big toe in my hand and I'm going to long axis distract, and I'm going to rotate it. I'm going to go M to L, L to M,
What side is it?
flex, extend, and I'm just going to continue motioning the toe until the clicking stops.